One of the issues that I wish more people would come see me for is acne, especially teenagers. I mean, I still can remember what it was like to be a teenager and having bad acne. And I mean, this face is what you present to the world, and it's such a cause of depression and anxiety when you have bad acne. And there are so many good treatment options out there. It might require a lot of trial and error, a lot of trying, a lot of seeing me. I'm okay with that. Hopefully you can make a time in your schedule to address this. But doctors can help you with acne, and I wish more of my teenage patients would come and see me about it because there's so much that we can try, so many options out there. So, today that's what we're going to talk about. What are some of the basic options to treat acne? What do I recommend for taking care of it? So, first of all, I do think that washing your face twice a day, once in the morning and once in the evening, is one of the basic first steps. I don't think that you need any particular cleanser. I really like the more gentle cleansers. The most well known for that is called Cetaphil, Cetaph or Fil. That's a really gentle cleanser that can actually also be used as a mild moisturizer as well. So using something to clean the oil off your face twice a day. And most people I don't think really wash their face long enough. You don't have to scrub it to death, but just like with your hands, you're supposed to wash your hands, believe it or not, for a whole 30 seconds and make sure you wash your thumbs and your fingers and the backs of your hands. And if you do it right, it should take a solid 30 seconds of soap under the water. And I kind of think the same way with your face. I mean, you don't have to be scrubbing at it with crazy things or sand or sugar or salt or whatever, but just make sure you're rubbing at it for a good 30 seconds to allow the soap to do its job, to kill bacteria, to get rid of some of those dead skin cells that fall off easily. Twice a day. And I'm a big fan of moisturizer as well. Something more greasy in the evenings and something lighter during the mornings is usually what works best for people. And makeup, sure, non-comedogenic makeup is the kind that's specifically tested to make sure that it doesn't increase your acne. Okay, so that's your basics. Start with that. If you're still having bad acne, or even if you have bad acne scarring, some people get pits where their acne has been. We can do things about that with topical medications or oral medications if it's really bad at your doctor's office. So whether it's your family doc, whether it's a dermatologist that you like, whatever you like. I'm a family doc. I feel comfortable with treating a lot of acne cases. So I hope you come see me if you're in the Colorado Springs area. But what am I as your doctor going to talk to you about? Let me zoom out a little bit to my beautiful dry erase board. Now, acne isn't something that bothers everyone. I mean, there's some people who the scarring, I mean, especially in male actors, if you start looking for it in your famous male actors, you'll start seeing more and more men with bad acne pitting scarring across their cheeks. I never thought about it until I was studying this. And yeah, in medical school, I started noticing it, and a lot of male actors make them look tougher or rougher. Clint Eastwood is a really famous one. He has bad scarring all over his face, and it contributes to his persona. So if that works for you, awesome, go with it. But if you'd like to do something about your acne, don't feel like there's not options. My two basic things that I like to approach is killing the bacteria that seem to be related to the acne and improving your skin. Improving your skin can be done no matter if you have acne or not. So if you have other lesions going on, if you've got red marks all over the place, these are options that might even help with that. So things like adapalene, either gel or cream, that's recently become over the counter. It's also called Differin, and that works on the underlying layer of skin to kind of help it grow in better. That's what all these do. And it can decrease scarring, and it can decrease your chance of having more acne in the future. It does take a solid 6 to 8 weeks to work, so applying that on a regular basis for 6 to 8 weeks before you see any change at all can be really frustrating because in the meantime you're also getting red and irritated skin. But for the long term, I really recommend it. Pretty much everyone I know, I think, should apply a SPF sun protectant in the morning and some kind of adapalene or T-retinoin in the evening. If you want awesome skin, that's the first step to it. But we're talking specifically about acne. So often you need something stronger than just a little bit of low-dose T-retinoin, also called Retin-A, or low-dose Differin or adapalene. So when you're thinking about increasing the potency of what you're putting on your face so it works a little bit stronger, a little bit better, You want to keep in mind that not only to look at the percentage, like 0.1% versus 1%, 1% is obviously going to be stronger, but also think about cream versus gel. Cream is not, when it's a white, creamy paste, toothpaste-like substance, that's not as strong as an ointment. If it's kind of a little bit see-through, kind of greasy feeling, that stuff is stronger and more potent in general, no matter what the percentage says. So those are both ways to increase the strength of what you're getting with these. Pretty much everything on here is going to irritate your skin, cause redness, dryness, irritation. So it's always a tough balance between taking a couple days off to let your skin heal and applying it again to try to have the good effects of that medication. If you're applying a moisturizer to combat that redness and dryness, which I'm all about, try to wait half an hour to an hour after you put the topicals on your skin, and that'll allow it to work well and then also soothe your skin afterwards so you don't get too irritated. Because, man, that's almost as bad as acne when your skin is just falling off and flaking all the time and all red. I hear you. I've been there. You're not alone. And put some moisturizer on, come and see your doctor, see what else we can do. So the stronger the potency of these, the more effect you're going to have. Ease into it slowly. Sometimes I say every other day apply it and then increase to every day. And then after you can tolerate every day, then try maybe a stronger topical, if a stronger potency, if you're not getting all the effects, all the benefits that you want to get. There's so many out there, so much to play with, and they don't always have to be expensive either. Work with your doctor to find something less expensive if it's getting pricey, because man, they can certainly increase those prices. And so that's the idea between adapalene or differin, and then T-retinoin or retin A is a little bit stronger. You can get that topically, or I mean the granddaddy of all acne medications is what used to be called Accutane, or an oral T-retinoin. It's a vitamin A analog, and man, it kind of destroys your skin for a solid couple months while you're on it. There's different strengths, different regimens that you can be on, different durations of treatment. That has to be done by a doctor who's got a special certification through the iPledge system to make sure that we're doing that safely. It has been related to possibly worsening depression. It definitely can have horrible effects on an unborn child if you happen to get pregnant while you're taking it. So big things to think about before you get on that. It's a very strong medication. It's also the only cure that we have for acne. It's amazing, but it's a tough one, and you really just can't be out in the sun much for the entire time that you're on that. So that's a possibility. Those are the big guns for if things get really bad. And then in the meantime, if you also, so improving your skin can be done at any point. Well, really don't go on Accutane unless you have bad acne or a bad other skin condition. And then we have killing bacteria. This is an acne specific area. Most other skin issues don't involve antibiotics, but acne definitely does. So we've got the basics from benzoyl peroxide. Benzoyl peroxide is commonly available over the counter in lower strengths. I can give it to you or another doctor at higher strengths. It can be used as a cream. It can be used as a wash. The thing about it is that it bleaches linens. So if you're going to wash your face and then dry off on a towel right away, just expect that that towel is going to lighten in color over time, going to get bleached, or just use a white towel. Or just do it and use it as a cream and apply it first thing in the morning, so that over the course of the day, you're unlikely to rub your face on much and bleach it. So think about ahead of time when you're going to the doctor, if you're thinking benzoyl peroxide might be a good way to do it. It's kind of like bleach. That's how it works by killing bacteria, is it just destroys it all. It makes your skin red and irritated, just like most of these do, but think about whether it would fit better into your lifestyle to have it as a wash or as a cream, whether you're going to apply it to, especially if you get acne on your chest or your back, which is very common. I like to recommend using the wash because that's easier to apply just in the shower and rinse off on your chest or your back than the cream is necessarily. But think about that. Another common product is salicylic acid. That's one that's in a lot of really expensive acne treatments out there as well. It's a good one for killing bacteria, but it's often overpriced. So if you're paying a lot for a brand name of acne remedy, please come and talk to your doctor about how to save a little bit of money with using those exact same ingredients. Often what sells that and what makes it work is you pay so much for it that you're going to use all 4 of the little bottles when they tell you to, because it costs so much money. So if that works, stick with it. But if you'd like to save some money while using the same kind of chemicals, come and talk to your doctor. Then getting more advanced from the topicals, you've also got, okay, well, the topical antibiotics, commonly clindamycin or erythromycin. Those are often sold in combination with some of these others as well, in order to address multiple ways of treating acne all at once. Pretty convenient. Again, causes dryness, irritation, redness, as all of these do with acne. Then you could also get into oral antibiotics, so something that you take once a day or more than once a day, depending on what medication it is. You take those for about 12 weeks, and you also want to be doing other topicals, both usually benzoyl peroxide as well as something else at the same time as those oral antibiotics. Some of those can cause some stomach upset, but they can be really effective for acne as well. So it's a balance between risks and benefits, as always. There's also dapsone, azelaic acid, ones that I'm not quite as familiar with, but are also good topical acne remedies. And there's all sorts of ones that are out there that don't have much research behind it, like light treatment, laser therapy, tea tree oil, bee venom, changing your diet. There's not really good evidence that any of those are particularly helpful, but if you find changing your diet really helps with your acne, then by all means, as long as that involves eating more fruits and vegetables, especially vegetables. But that's my little spiel that I usually give on treating acne. Hopefully that gets you started in the right direction in getting your skin better. And please, if you're struggling with depression, especially if you have acne, please come and talk to someone about it. It's a really common thing to have. You're not alone. And it's just a horrible thing to have to suffer through when you're a teenager, is having bad acne. But I've been there. My family's been there. Please come and talk to someone. But while you're on YouTube, subscribe to our channel right there and check out that video. It might be of interest to you. Thanks for watching.